Hey everyone, it's Tony Leonardi, certified financial planner professional and author of A Smarter Way to Retire, back with another episode of A Smarter Way to Retire podcast. If you're wondering why I use that fairly awkward title, certified financial planner professional, it's a mouthful, it's because I have to. The Certified Financial Planner designation is owned by the College for Financial Planning, and they have very strict rules about how we use that designation in terms of font size and how we communicate that to the public. So that's why I have to use that mouthful. Certified Financial Planner Professional. If you're interested in learning more about what a CFP is, you can go to the College for Financial Planning website. It's a great resource. They actually have a Find a CFP in Your Area search, which is interesting. I've actually gained a few new clients through that search capacity, which I'm thankful for. So check out the College for Financial Planning website for more information. Today, we're continuing on our rotating retirement topics to help you build a confident financial future. We're not chasing after hot stocks, and we're doing our best to stay above the fray of the headline news, and I would encourage you to do the same. Last week, we talked about artificial intelligence in financial planning and how it's being integrated into the tools that we use to make me a better planner for you. And I think it's really exciting where this industry is heading. It helps us crunch data and come out with better outcomes, better projections for you. Today, we're talking about longevity planning. As more folks live to age 100 and beyond, and with rising healthcare costs threatening even the best plans, it's a very important and timely topic. Do you want to know your retirement's probability of success? Well, you can book a complimentary consultation with me on my website. Look for my Calendly link. Or grab a no-cost copy of my ebook, A Smarter Way to Retire, LeonardiFamilyWealthCare.com. So let's get started. So why longevity planning matters? Well, longevity planning is about preparing for a retirement that could last 30, 40, 50 years or more. When Social Security was first introduced in the United States with the signing of the Social Security Act, 1935, the average life expectancy at birth was significantly lower than it is today. According to data from the Social Security Administration and historical demographic studies, average life expectancy at birth, if you were born in 1935, was approximately 61.7 years. Imagine that. 59.9 for men, 63.9 for women, but around 61 years was the average life expectancy. So you can see how Social Security, that program, was kind of interesting, the way they designed it. You would pay in for your entire life and only get, if you're lucky, a few years of payouts. Things have certainly changed. If you made it to age 65 by 1935, your life expectancy increased a little bit by about 12 years or 12 years for men, 13 years for women. 77, 78 years old if you made it to 65. With life expectancy for a 65-year-old now hitting 85 for men, 87 for women, per the Social Security Administration, and 1 in 4 people are living past age 90, we're seeing more clients who want to plan for age 90, 95, even 100 and beyond. My book, A Smarter Way to Retire, 10 Steps Towards a Confident Financial Future, emphasizes dynamic, flexible plans using smart modeling tools like our Money Guide Pro software. We don't do static budgets or guesswork. For high net worth retirees, longevity means making your nest egg stretch out longer and addressing healthcare costs, which can balloon to, some studies say, $300,000, $315,000 for a couple retiring this year, according to Fidelity. And that excludes long-term care costs. Long-term care like nursing home or in-home aides can cause an additional $100,000, $150,000, $200,000 annually. Medicare doesn't cover that. Without a plan, these costs can drain your nest egg pretty quickly, a big concern if you want to leave a legacy for your kids or grandkids. Our modeling helps to model these risks, running thousands of scenarios to help ensure your wealth lasts as long as you do. Today we'll unpack strategies to protect your financial future while staying healthy and independent to age 85, 90, 95, and beyond. So let's dig into the details of longevity planning. I submit to you, ignoring longevity risk is like hiking Bryce Canyon in Utah, which I did a couple weeks ago, without a map. It's beautiful but risky. Smart dynamic modeling helps to ensure your plan adapts to a longer life. Before we tackle healthcare costs, let's talk about planning for lifespan, well beyond average life expectancy. Many folks assume they'll live to age 85, but what if you hit 95 or 100? Current client couple, both age 65, were planning for an age 85 life expectancy. But then when we looked beyond that, we saw their portfolio success rate drop to below 70% when we extended their model to age 100. By adding a 10 to 15% buffer, extra savings, a tweak to their portfolio, and some conservative withdrawal rates like 3% instead of 4%, we were able to boost their probability of success to 90%. So a couple of tweaks can make a big difference over a long period of time. So this buffer accounts for unexpected costs or market downturns, helping to ensure your plan doesn't run dry. Without it, you risk cutting back on travel, gifting, or legacy goals like funding grandkids' education. Our modeling software models thousands of simulations to help you stress test for longevity, giving you the confidence to live fully. Also, if you're relying on your investment portfolio alone to supplement your Social Security, you're taking on an additional risk of running out of money, especially if you experience significant volatility early in your retirement years. If Social Security is your only form of guaranteed lifetime income, this could be a problem for you. Some people have pensions, which is a great supplement to Social Security, another form of lifetime income. But fewer and fewer people are retiring with pensions. Most workers today have what we call defined contribution plans like 401ks, where we know how much is going into the plan. That's why they call it defined contribution plans, but we don't know how much will come out, and we can't guarantee that. That's opposed to the older style defined benefit or pension plans. So if you're planning for a retirement without a pension, like many are today, or if you're currently retired and relying on your investment portfolio only to sustain you long term, you might want to consider the value of adding an annuity to your portfolio. Annuities come in all shapes and sizes and flavors, and so much so that we'd need an entire episode just to cover the basics of annuities. And maybe we'll do that one day. I think that's a good idea. For today, let's just think of an annuity as another form of guaranteed lifetime income that you cannot outlive, like Social Security or a pension. In our modeling, we can play with the idea of adding an annuity to see if that will improve your long-term probability of success. Isn't that what all this planning is all about, improving your odds of success? If you'd like to know if an annuity or a tweak to your portfolio would be helpful for you in your situation, I'd be happy to model that out for you. Just let me know, I'm here to help. Now let's explore 5 key strategies with real examples to bring it home. Let's look at healthcare costs and those projections. A 65-year-old couple retiring in 2025 faces $315,000 in out-of-pocket costs for premiums, co-pays, and deductibles. This is according to Fidelity's 2025 estimate. That's assuming no major illnesses. Long-term care adds another layer of costs. $108,000 on average per year for a private nursing home, or $60,000 per year for in-home care, according to Genworth's 2025 Cost of Care Survey. These are average numbers across the country. From what I've seen with my clients in real life and their parents, these numbers are pretty low. I have clients currently that are spending $15,000, $20,000, $25,000 per month on care for their parents, which is really doing a number on that nest egg. Some are spending down their parents' savings, and others have to dip into their own savings and investments. It's sad to see, but we'll do anything for our families, right? For high net worth clients, these costs hit harder if you own multiple properties or travel extensively. A client couple, both 62, used our smart modeling to project $400,000 in healthcare costs over the next 30 years, adjusting for 7% annual medical inflation. By modeling and allocating $200,000 from their portfolio for a dedicated healthcare fund, they boosted their plan's success rate from 80% to 92%. Great example of how planning well in advance can be so powerful. What about long-term care insurance? This could be a game changer for protecting your wealth. Traditional policies cost $2,500 to $5,000 a year or more for a 60-year-old, covering $150,000 to $300,000 in care expenses. But buy early because premiums jump 8 to 12% per year after age 65. The problem with traditional policies, if you never use the insurance, all those premium payments may be lost, like homeowners insurance if your house doesn't burn down. If you don't use it, you lose it. Hybrid policies are the current answer to that issue. Hybrid policies combining life insurance and long-term care are very popular now for flexibility. If you don't need care, your heirs get a death benefit. For example, a client paid $4,000 annually for a hybrid policy with a $200,000 care benefit or a $150,000 death benefit. Our modeling showed that it helped to preserve their $3 million portfolio, maintaining a 95% success rate, even with a 10-year care need. That's, again, the power of modeling. What about Medicare and Medigap planning? Well, Medicare starts at age 65, but it's not free. Part A, or hospital, is usually premium free, but Part B, doctor's visits, cost $185 a month in 2025, and Part D, prescriptions, adds another $40 to $100 per month. High net worth clients face IRMAA, IRMAA. Does anyone out there know IRMAA? No, she's not your friend Irma from pickleball. IRMAA stands for Income-Related Monthly Adjustment Amount. They're surcharges. Up to $600 a month for Part B if your income exceeds $103,000 for a single or $206,000 for a couple. Your financial model will be very helpful here, helping to keep you below those IRMAA levels if you find yourself getting close. I have one client that always seems to be right there on that IRMAA threshold, and we are constantly referring back to his model to help him stay below that threshold level. It could be a huge tax savings for you, which is another advantage of having a real-time dynamic financial planning model. Medigap plans cover gaps like copays, which cost $150 to $300 a month, or you can use Medicare Advantage for lower premiums or with a narrower provider network. I have a client who saved $2,000 a year by switching to a Medicare Advantage plan with dental and vision, which we modeled to fit their travel-heavy lifestyle. How about health savings accounts, HSAs? HSAs are triple tax advantaged. Pre-tax contributions, tax-free growth, tax-free withdrawals, almost like a Roth IRA for medical expenses. In 2025, you can contribute up to $4,150 for an individual or $8,300 for a family, plus a $1,000 catch-up if you're over 55. You can invest your HSA funds in low-cost ETFs for growth. For example, $50,000 invested at a 6% growth could grow to $180,000 in 20 years. I have a client couple who maxed out their HSA contributions for 10 years, building a $120,000 healthcare bucket, which our modeling projected would cover 80% of their medical costs to age 90. How about lifestyle and legacy? Longevity isn't just financial, it's staying active and planning your legacy. Simple home modifications like grab bars or stair lifts help prevent falls, and falls can cost $50,000 or more in hospital bills. Wellness programs like yoga, fitness, weightlifting, weight training can help keep you independent. Refer back to our podcast with Phil from Wits and Weights, I think it was episode 19, for some great information on the health-wealth relationship. Tie this into your legacy plan. You can use the $19,000 annual gift exclusion to fund 529 plans for grandkids for their education or support charities with qualified charitable contributions, QCDs, which allows you to give up to $100,000 per year from your IRAs after age 70 and a half, tax-free to charities. We have a client who gifted $38,000 a year annually to 2 grandkids, helping to reduce their taxable estate while funding college, with our modeling showing that their 35-year retirement projection stayed at the 90% probability of success level. Again, the power of modeling. These strategies work together. For example, a couple I worked with faced a 75% success rate due to unaddressed healthcare costs. By adding a hybrid long-term care policy, maxing out HSAs, and gifting strategically, we boosted their probability of success to 94%, all modeled in real time with our smart modeling. Unlike brokers chasing hot stocks and returns, my approach integrates health, wealth, and legacy planning, working towards a confident, long, and happy life. Ready to plan for longevity? My 2-phase process starts with a complimentary 1-hour consultation. We gather your financial data, assets, income, expenses, and goals like staying independent, traveling, or leaving a legacy. Using our smart modeling software, I run thousands of scenarios to calculate your retirement's probability of success and identify steps to optimize for healthcare, long-term care, or gifting. You'll get a clear baseline, like a client I have who learned that their $2 million portfolio needed a $150,000 healthcare reserve in order to hit that 90% success probability. From there, you decide if a formal plan is needed to refine your strategy, like adding a long-term care policy or HSA contributions. Sharing financial details can feel daunting, but as a CFP professional, I'm committed to earning your trust. Book your complimentary consultation with me on my website. Look for my Calendly link. It's only an hour to gain some clarity. Or grab a no-cost copy of my ebook, A Smarter Way to Retire, at leonardifamilywealthcare.com to start your planning today. So that's it for this week's A Smarter Way to Retire. I'm Tony Leonardi, certified financial planner professional, helping you build a confident financial future. Follow us on Instagram, Tony Leonardi CFP, and Facebook, Leonardi Family Wealthcare. Subscribe on Spotify or Apple Podcasts or even YouTube if you want to see video, and leave a review, please. It helps others to find us. Next Friday, we're exploring alternative investments. That should be a fun one. So don't forget, book your complimentary consultation with me. Look for my Calendly link on my website, leonardifamilywealthcare.com, and plan smart to retire happy. See you next week.
Securities and investment advisory services offered through Osaic Wealth, Inc., member FINRA SIPC. Osaic Wealth is separately owned, and other entities and/or marketing names, products, or services referenced here are independent of Osaic Wealth. The opinions expressed herein are for general information only and is not necessarily the opinions of Osaic Wealth or its representatives. Investing is subject to risk, including loss of principal invested. Past performance is not a guarantee of future results. No strategy can assure a profit nor protect against loss. It is not intended to provide specific advice or recommendations for any individual. Please consult your financial professional, attorney, or tax advisor with regard to your individual situation.